We know all too well about the severity of the opioid epidemic in this country, but something you may not realize is that dental treatments actually account for 10% of all opioid prescriptions, and a good portion of those are written for adolescents. Dr. Ted Wong, he's the Chief Dental Officer at United Healthcare. He's here to talk about the concerns of this on National Children's Dental Health Month. Doctor, great having you.
Hi, Sean, and thank you for having me on your show.
So let's talk about this. I mean, obviously, opioid prescriptions are something to be taken seriously. A number of these being prescribed for younger patients is pretty jarring. How do we handle this with our younger kids who are probably more susceptible to this?
That's correct. Our United Healthcare data informed us that 45% of opioid prescriptions are written by dentists for teenagers and young adults. And the explanation is that's the age group where you're more likely to have your wisdom teeth removed. Yep. They estimate that 5 million people a year will have their wisdom teeth removed, and 70% of those procedures are associated with a opioid prescription. And for that age group, you're more susceptible to the addictive effects of opioids because your brain is still maturing.
Yeah.
And you're at a higher risk of misusing or abusing opioids.
So how do we make sure that these aren't going to be misused or abused in the first place? Or is there something we can do to kind of step between that?
Well, I would say prevention is the key. So minimize or eliminate the use of opioids. If you or a loved one are going to go in for a procedure, dental procedure, don't be afraid to ask questions and have a serious discussion with your dentist about opioids. Ask your dentist, do I really need an opioid? If it is indicated that you need one, then ask about limiting the supply, the number of pills you get, and the strength or dosage of those pills. Is
there a good alternative to using an opioid that you would suggest?
Recent studies have shown that common over-the-counter medications like Tylenol plus Motrin is as effective, if not more effective, in managing dental pain compared to opioids without the risk of addiction.
Okay. Fair enough. Now, what about, let's say we did have a prescription, we only used a few of the pills, there's a whole bunch of them left. How do we properly destroy what's left? We don't want to flush that down the toilet, it'll go into the water system.
Absolutely. If you have unused opioid pills, you don't want to simply throw them in the trash because then those could be easily retrieved and misused. Instead, you can give them back to the pharmacy, you can give them to law enforcement. The DEA has a drug take-back program twice a year. The pharmacy can provide disposal bags specifically for opioids, which inactivate the ingredients in an opioid pill. Or you could simply take the unused pills, mix them with water, and grind them up with things like kitty litter or coffee grinds to make them unusable.
I've seen what my cat does. You do not want to even try. If it's in there, it's lost forever. Really quickly, I mean, obviously, it would be great to not have to be in the oral surgeon's office in the first place. How do we avoid getting in there, with the exception of obviously wisdom teeth? That's just a luck of the draw situation. But how do we avoid getting into that dental chair in the first place?
Well, obviously, prevention is the key to avoiding a lot of unnecessary dental treatment, meaning get your annual exams, get your annual cleanings, and make sure you brush and floss and maintain your oral hygiene. The better you take care of your oral health will have a significant impact on your overall health.
I'll tell you, I can do the brushing. I'm trying on that flossing. I'm 34 and it is still tough. Doctor, it's great having you, my friend.
Thank you for having me on your show,
Pleasure.
Sean.
Hey, if you want to learn more.
And make sure your viewers go to newsroom.uhc.com for additional information on this opioid topic.
That's absolutely true. Thank you so much, Doctor. Again, to learn more about the connections between the opioid epidemic, oral health, young people, you can visit that website, newsroom.uhc.com. United Healthcare, a proud sponsor of the Morning Blend.